Hi, DeWeed. I have another article for you. This one from Phoenix, Arizona, on medication administration documentation error. They looked at 481 patients. What they wanted to know was, does a nurse-initiated protocol reduce documentation error? So when I started nursing, there were like 5 rights of medication administration, something. I think there's 104. But anyhow, the big problem they found in documentation was related to patients with NG tubes. In their protocol, what they did was brilliant. They had nurses work to their fullest extent of their licensure. If the nurse saw that the patient had PO orders and the patient had a feeding tube, they could contact the pharmacist directly. They didn't have to contact the physician first. And guess what? It worked. No one was surprised. 85% of the time for patients with medications that were scheduled, it worked fine. The only problem came with patients who had PRN meds, and about 20% of the time they had some issues. I love this study because it makes sense. And it means if you let nurses work to the fullest extent of their licensure, patients get better care, things happen more quickly, the hospital saves money, and the physicians have less work to do. What a great study. This is in the Journal of Neuroscience Nursing, and bonus, you can get continuing ed for this one. Please read.